Welcome back, everybody. September is Ovarian Cancer Awareness Month. According to data from the American Cancer Society, ovarian cancer ranks 5th in cancer deaths among women, accounting for more deaths than any other cancer of the female reproductive system. Dr. Jennifer Scalisi from USA Health joins us now. Dr. Scalisi, thanks for being with us. How common is ovarian cancer?
Ovarian cancer, all things considered, is relatively rare. It affects 1 in 77 women, but you don't have to look very far to find somebody who's been affected by this disease. And the problem with ovarian cancer is that it's a sneaky disease. It presents with symptoms that many women attribute to more benign conditions, irritable bowels, irritable bladder. And by the time we really identify the disease, 60 to 70% of the time, it's in its advanced stages, which makes treatment a little more difficult.
So what do we need to do to get an early diagnosis for ovarian cancer? How do you diagnose it then?
So we do two things we're doing here. Number one is we are conducting basic and translational research to better understand the disease in its early stages so that we can develop better screening practices, better screening tests. There is no mammogram or colonoscopy equivalent for ovarian cancer, and that's what we're trying to develop here in our lab at MCI. The other thing that we're doing is try to empower women to advocate for themselves, to know their bodies, and to empower them to speak with their physicians when things don't feel right. There is excellent data that ovarian cancer, traditionally thought to be a silent disease, isn't silent, it whispers, and we need to kind of empower women to talk to their physicians to become their own advocate.
Absolutely. So is there a particular population that this typically affects?
It doesn't seem to be, actually. We know that 5 to 10% of cases can be hereditary. So we've established a genetic clinic here at MCI so that we can counsel women who have strong family histories of breast or ovarian cancer. One risk-reducing tool that we have at our disposal is a risk-reducing surgery. And so any women that we know are at an increased risk for this disease, that's a discussion that we have in that clinic. But in general, the vast majority of cases are not genetic or not hereditary, and there doesn't appear to be any particular population that's more at risk. We know, though, that cancer outcomes and treatment outcomes can vary by a variety of characteristics, race being one of them, ethnicity being one of them, so we're actively studying that here at MCI as well.
All right, Dr. Jennifer Scalisi, thank you so much for joining us tonight.
Thanks for having me.